Hello and welcome. My name is Alana Gordon. I'm a reporter and producer at The World covering global health. And this is a Facebook Live Q&A about the coronavirus pandemic, mental health, stress, and resiliency. With me is Dr. Keristan Konen, who is a professor of psychiatric epidemiology at the Harvard Chan School of Public Health. Thank you so much for joining us.
Thank you, Alana. Glad to be here.
I'm really looking forward to this timely discussion. And you can post your questions for us at the Facebook pages at Forum HSPH and at PRI The World. Or you can email them to the forum at hsph.harvard.edu. And this Q&A is jointly presented by the Forum at the Harvard T.H. Chan School of Public Health and The World from PRX and WGBH. And again, we are doing this by Zoom through Facebook, so thank you for your patience. And I don't want to wait too much longer to just jump in, Keristan. So I wanted to start with kind of a national mental health checkup, if you will. I'm seeing reports of increases in calls to crisis hotlines, mental health lines, frontline workers, health workers especially, are really suffering from responding and witnessing to some really horrific scenes and events. And I wanted to start off by asking you what you're observing in terms of what's emerging with people's mental health as the COVID-19 crisis wears on.
Thanks, Alana. Yeah, I'm really delighted to be here to talk about mental health because we do see an emerging potential crisis. A recent Kaiser Family Foundation poll found that over half of Americans are talking about mental stress related to COVID-19 interfering with something in their lives, like their sleep, their eating. We're seeing increased alcohol use. And that's even higher among two groups, healthcare workers, as you mentioned, and also those people who lost their jobs or are facing increased economic stress. And then at the same time, people have fewer resources to deal with it. As we know, my son's in the other room at home, other people's kids are at home. So there is also those stressors. So there really are a lot of signs of concern.
And so seeing these signs of concern, I wonder, how does that compare to other circumstances or situations when we think about big events that we experience as communities, as individuals?
Yeah, that's a great question. So in my work, I've studied all kinds of different events. I study events that happen to individuals, like being sexually assaulted, and then I've studied disasters. And this is, in some ways it's comparable to a disaster. There are some differences. I lived in New York when the 9/11 terrorist attacks occurred, and there's a lot of things about this that remind me of that time, because of the community. Living in New York, the community-wide impact, the fact that it was like all anyone talked about. There was an enduring sense of threat at that time, although people who didn't live through it might not remember that. And things were shut down. And if people were alive then, all the airports were shut down. So there are things that remind me, but I think the difference here than other disasters is how long lasting this is. Usually disasters are more an acute event, a hurricane, and then there is the things that happen after, which can last. But now we're going into months and months. And the other thing that's different is it's really affected the whole world. So it's the nation, but also it's the first time in my lifetime that I've had an experience where everyone I talk to in the world, and I do a lot of global work, it has some element of the same thing. And I think that while we can find community together, it's also straining everyone's resources, which undermines our ability to deal with it. And then the other thing I really worry about is in disasters, we know that social support is so important to buffer the effects of disasters, to help pull people out of disasters. And here we see that because of physical distancing, which we need to do, we're sort of robbed of some of that social support. So that's extra challenging.
Yeah, that leads to one of the things, my questions for you, which is there's been this emergence and really surge in virtual connections.
Like this.
Yeah. In what ways does that substitute or fall short? What do you know about how these connections make a difference, but also it's not the same as a physical connection or a presence of somebody.
Right, exactly. I mean, I think it's a mixed bag. On the one hand, I realize I'm really grateful that we have that opportunity now. If this had happened 10 years ago or 20 years ago, we wouldn't be having this conversation. I wouldn't be able to Zoom with my mom. I wouldn't, my son wouldn't be able to learn online. So those are the positives. At the same time, we're sort of fooling ourselves that we feel like this can substitute for the physical connection of being in the same space, or the physical touch of being able to see a friend and hug them, or smile at your neighbor, because now we're wearing masks. As humans, we evolved to connect with each other physically and socially. So it does rob us of something, not having that physical presence. And I think that, it's something we need to do right now, but it's also important to acknowledge that we are missing something, and that this won't be a complete substitute. On the other hand, it is a great resource we can use. And one of the things, for example, I've been doing is I've been connecting with friends that it's usually hard for me to connect with because they're sheltering in place in California. So now we can video, we can connect, when before it would have taken us probably months to work that out. So there are sort of pros and cons, but it's certainly not a replacement for the physical.
Yeah. Another thing I wonder about is, and there are questions coming in about this too, about what are some of the trends you see? You mentioned just that emerging, though, in people's mental health as COVID-19 crisis wears on. You mentioned 9/11 and this, but that this is longer. And I wonder if there's research within psychiatry or mental health that can give us clues to how to respond to that or be aware of kind of this ongoing thing. I know that I'm going to kind of combine this with another thing, which is, you've organized this kind of weekly online forum on mental health and COVID-19. And it's been going on for about a month and a half as I was scrolling through. And there's a lot of different topics like managing stress, avoiding sleep problems, recognizing grief and loss. This is all coming at us so fast and hard. And I wonder, in that sense, if you've seen things evolve and change, or how you kind of imagine the questions coming in differently. Maybe it's a more specific way to get at this big question that I'm wondering about.
Yeah, no, we have seen things change. So the forum really grew up organically. They're 11 a.m. for people on Wednesdays, and we also video them and they record them, put them online. But it grew organically, and actually, I have to say, it was partly inspired by a student of mine who is a psychiatrist in China, who came back in February after the COVID had blown through China, and was in my office and was really sobbing about what he had seen in China, especially the effects on healthcare workers, and all the things we're seeing here now. And he and I started talking about it. And so when COVID became emerging as an issue here, I had sent an email to my group saying, we should talk about mental health effects, because a student had brought them up. And the email got forwarded, and our first sort of group conversation ended up being over 100 people, which made us realize that this was on everyone's mind, even though it wasn't what we were focusing on. So the forums have really been targeted at raising awareness, but also really trying to give people practical skills. So the one on sleep talks about sleep problems, but it also talks about, okay, it's normal under stress. So it's actually normal to feel stressed and anxious, to have days when you feel hopeless because, things are crappy, to have trouble sleeping. But to try to give people skills to ensure these don't become chronic problems. So if you're having a few nights trouble sleeping, what are some things you can do to help you sleep better? And I think that one of the questions that have come out over time are questions about, well, what's normal with stress, and then what's actually a problem? That's sort of what we see emerging. And then also around people feeling burned out. Worrying about healthcare workers burned out, but also people themselves feeling kind of burned out. I was able to get through April, but now there's May, and now I can't, and sort of that uncertainty for how long it's going to last, et cetera. So I think that sort of a long answer to your question, but hits on a few issues.
It sounds like people are starting to identify these blurry areas, or trying to understand and identify things that might be more acute now, or it's just it's a day seems like a day, or a year, and it's
exactly.
I want to remind people this is a Facebook Live, so you can please join in with comments and questions. some of what you've said has been touched on here, but I want to get to some other specific questions from people here. One thing that has come up a lot in questions has to do with, you know, and you mentioned with students, although the older, like the impact on kids and young adults. So this question is from Stephanie, and she wants to know, can you share with parents of teens who've been out of school for weeks and months? There's this social, emotional, mental health aspect to what's happening right now and how that might impact their developments. So what are you seeing this as being an impact? And do you have advice if school doesn't resume in the fall?
Oh God. I feel Stephanie's pain because I have a 13-year-old son who said is in the kitchen working, and I begged him not to fly in with something while we're talking here. So a couple of things. So one, in our resources websites about kids generally, is there are a lot of specific different things we would say for different developmental stages, and I'll just talk briefly about teenagers since that's what Stephanie raised. But I think that one is I try to remind myself that kids are resilient, and that's not just sort of just saying that. They actually, they're usually more resilient than we know. And so they often can adapt to new circumstances and can be more innovative than we are. And so some of the things I would tell parents, and I try to practice myself, is that one is with my son is try to be realistic about expectations in terms of what you want them to do and not do, and pick your battles. This is always true with teenagers, but especially true right now. So you might let some things go that you wouldn't let go. I can say my son's gaming more with his friends online than he normally ever would during the school year. And every day I have to be like, that's okay. There'll be a time when he's back in school. The other thing is that this will pass. I think that for most kids, this won't have some big adverse effect on their development. Kids are much more concerned with, especially teenagers, with what bothers them right now. So, you know, are the SATs, are they going to be able to take the SATs that they prepped for? Or are they, you know, how is it going to go visiting colleges? So some of that thing. And then the last thing for parents, I could talk about this for an hour about parents, but is really kids, even teenagers who might dismiss us all the time, really look to how we're doing to figure out how they should be doing. So for parents, really, one of the most important things you can do, and this also it sounds corny or cliche, but it's true, is kind of take care of yourself. Because if your kids see that you're sort of taking care of yourself, that will speak, and that you are managing, that will actually speak more to them and will show them more than if you are super stressed out and but telling them, oh, everything's fine, but mommy's freaking out. So really, kids take their cues from what we do, especially teenagers, what we do, not what we say. So I try to think about that. If I am saying be more reasonable expectations, am I doing that for myself, not just for my kid? So.
Is there any understanding about something like quarantine or not going back to school beyond, a month and a half, if it extends so long? On mental health?
Yeah, that's a good question. I mean, there's a lot of research on mental health effects on quarantine, although it tends to be under more severe, like true quarantine, which is like truly you're in your house, in a room, away from everyone. More of a situation now that for people who are actually very ill. And then in terms of this exact situation, there really isn't much data. We know from other epidemics like Ebola that when they've gone back to communities a year later, that there are some elevations in sort of depression and anxiety among the community. But in terms of this specific situation, we're really treading new ground. So I think
Is there research being, I hate to make this like intellectualizing it because a lot of practical questions.
You're talking to a researcher, so
are there studies being set up?
Yes, there are. I mean, there are a lot of different. I mean, the mental health community, among all the research communities, one thing that's been amazing is the amount of. I've seen this in infectious disease, the amount of collaboration globally, and the same thing has happened in the mental health community. I was just on a meeting yesterday, which is this international cohorts consortium. So people who study kids and families and adults over time. And sort of everyone's jumping in to look at these questions. So the mental health effects, developmental effects, and also the effects of specific, if you're specific social distancing or physical distancing practices. So how that affects kids' mental health. So I think it's something we'll know more about. And it's like our teachers going online. This was an experiment most of them, at least in Brookline where I live, they were told Thursday night that they had to go online starting Friday. So they're learning to teach our kids like as they do it, just like we're going to learn how to manage this as we do it. And then we'll know better. Hopefully there won't be a next time, but we'll know better in the future.
I agree. I could keep asking more. We could keep going through more questions about kids. And I want to note to people who submitted questions that I want to revisit these questions, but I want to kind of keep going with some of the other themes that have come up. So this question's from Kimberly, and it's about seniors. They're under enormous stress. And do you have any helpful tips about how to, when you think about supporting seniors in this time, and the elderly?
Yeah, this is another one I feel Kimberly's pain. My own mother lives in Atlanta. And she just recently moved right before this started, and she's in a sort of temporary rental apartment in Atlanta. And she's been socially distancing from very early because she did actually, so when she doesn't listen to me, but she listened to me on this, which was good of her. An extra challenge she's facing is that she is in Atlanta and in Georgia where they're relaxing social distancing and opening up, right? So she had a feeling, what supported her until now was that everyone was in it together. We were all, physically distancing. And now she feels even more isolated because she's been told by the state, you stay home till mid-June, but everyone else can go out. So there's no more. So she looks out her window and sees other people at restaurants and stuff. And so that actually has really added and made her feel probably more depressed. So anyway, so just to acknowledge it's a real issue. So some of the tips there are, so on an individual level is my siblings and I talk to my mom and we call her more than we would have in our normal lives and check in with her. Sending people stuff. I have people who work with me who send their parents cookies or flowers or we've been cards, having my son write a note. So kind of reaching out more. There are organizations, and maybe we can share them through our website, who are actually pairing younger people with seniors who do that normally, but are now doing it virtually. And the other thing I've done for my own mom is kind of try to look at resources in her area or help folks technologically, okay, if you guys wanted to set up your book club on Zoom, how would you do it? And so that's one of the challenges, at least for my mom. She's not always so online all the time. So those are some tips to really try to keep people connected and maybe realize that some older adults maybe even feel more isolated now as if they're in places that are lifting restrictions.
That's an interesting way to look at it and being aware of that dynamic happening. I want to ask this question. It comes from Maureen about healthcare workers, which is, how do we deal with the heroism in healthcare workers to get them help before they experience a crisis?
Yeah, that's a great question. So I think this is something that luckily we did learn a few things from previous crises, both in terms of healthcare workers who served in war zones and then also who served in emergency situations or in conflict areas or in the other epidemics like SARS and Ebola. So, for example, there's already been studies coming out of China on elevated symptoms in healthcare workers. So I think there's a number of things. So one is many institutions, including Mass General, have developed supportive interventions for their healthcare workers. So I think that those are out there. So some of it's about linking the healthcare workers with those resources. I think the other thing is I hear reports from healthcare workers that things like in New York City, people cheering, people showing community support and recognition for what they're doing, I think it's something small we can all do. It can go somewhere. And then we are actually having a forum in a couple of weeks for family members and friends of healthcare workers. what can we do for the healthcare workers? Because we had so many family members of healthcare workers emailing us and saying, well, what can we do to support? And actually, we do know something about that from, unfortunately, from other conflicts. So I think there are some different things. I also think recognizing that the long-term effects on healthcare workers, who they don't have time now to take a break or relax or do stress reduction techniques. So I think that's going to have to be an institutional issue as well, that the institutions are going to have to deal with, is how to support and make sure people have time to recover from this as hopefully things sort of slow down a little bit.
I've talked to a lot of health workers and doctors who kind of don't want to stop right now because it's just like they can't process, like they just feel like they want to just keep doing. Right. And I wonder if you think that's a good idea.
I think that's a good idea. Well, I think that people are essentially very resilient. We see this over and over again with trauma. So when you study a disaster, often in the acute aftermath, people have a lot of symptoms. They look like they have sort of anxiety, depression, PTSD. And then over time, people do find ways to recover. And so that's not to minimize at all issues people are facing. But I think that for some people, doing is a way of coping. And as long as there's stuff to do, that's okay. And there may be a point where they stop doing because hopefully the burden will be less on the system, and they will need to, at that point, they will need to probably take the time and process it. But when you're in the middle of something, even for any of us, it's actually very hard to process something when you're in the middle of it. You've really got to get to a place where you're a bit beyond it before you can take that time and space.
A question came in from online about having read a New York Times article recently about a lead emergency room doctor in New York who died by suicide. It's a lot to take in, and the family hadn't reported symptoms or signs before. And the question has to do with, I want to combine this with another question, how to support people. But Frank also asked, what's the best way to encourage first responders to go to employee assistance programs and services? And like ridding the stigma of seeking counseling is a sign of weakness. There's just so much, I think, packed into all of this in terms of recognizing things and in oneself. But I wonder if you could talk about that. And how
sure, that was devastating. And one thing I think people aren't aware of is that there actually is quite a high suicide rate among healthcare workers and physicians anyway. I don't know if it's the highest profession, but it's one of the higher professions.
I have seen studies that say the rate is the highest, but it's
very high. Yeah. So it's a problem. It's always a problem. And burnout among physicians and healthcare workers is always a problem. I've been reading about this a bit to try to understand also how to best help. And so I think in terms of it, the key issue is the stigma. And I think that organizations a lot of this is on institutions and organizations, not just on individuals, and that institutions really need to lead the way in promoting a culture of wellness among their staff. And that means to start from the top, that, at the top, people need to recognize and make available resources for healthcare workers. So it's not something like, oh, you don't wait for someone to have problems with their job before they go to EAP, but that it becomes a sort of acceptable part of the organizational culture. And one thing I've seen encouraging in the pandemic is places that I'm affiliated with, like Mass General, have from the beginning put together resources on mental health and also resources for healthcare workers. It's sort of like they knew from the Boston Marathon bombing, they knew from previous things they've experienced that this was going to be an issue and sought to address it from the beginning rather than waiting. So I find that encouraging.
This question comes from the Pioneer Valley Coalition for Suicide Prevention, which is kind of building on that question, but expanding outward, which is there's been discussion about a potential increase and during this crisis. And what do you think about those concerns? And do you have suggestions for broader prevention efforts? And I do want to add, as we're talking about all of this, that there are, if family members or people tuning in have a mental health or substance use problem or question, or mental health question or concern, there are hotlines. There's the SAMHSA's National Helpline at 1-800-622-4357, and the National Suicide Prevention Lifeline at 1-800-273-8255. Just wanted to add that in our conversation.
Yeah, no, thank you, because thank you for putting those resources. And if anyone feels like hurting themselves or suicidal, or family member mentions that, it is really good to call. Those resources are excellent. I think so there have been reports that we could see an increased rate of suicide, and we don't know. We know from the SARS epidemic that there were some evidence that there was an increased risk among older adults related to social isolation. And historically, in certain groups, people who are adversely affected by an economic crisis, you can see increased risk in certain groups or increased rates of suicide. So there are things that suggest that it is something for sure that we need to be aware of. And I think a lot of the points we mentioned is making sure people are aware of the resources out there, that we reduce stigma and we talk about these concerns. And I think actually all the public attention and the articles, and the article about that ER doctor, the positive that can come out of that tragedy is that it makes people much more aware, and institutions more aware of the risks. And awareness is an important first step. And then after that, making sure that people have resources available, like the hotline you mentioned, through their institutions. And one thing that has come out of the pandemic is that there are a massive amount of resources online for people. If people need them, those are there. But definitely it's something we should be concerned about.
So that leads into a question from Laura about telehealth. When we think about online virtual counseling.
Yeah, exactly.
For mental health, how do we know how effective this is, or like for who in particular is this good for, and is that really a sustainable alternative?
Yeah, that's a great question from Laura, and I think there's a lot of research. I think this will stimulate a lot of research on telehealth and the use of also apps. So telehealth can be phone calls, it can be video, it can be therapy via video, but it could also be all these sort of online chats and applications on your phone, et cetera. And so a couple of thoughts. So actually the VA, people may not think of the VA as an innovator, but the VA is a massive innovator when it comes to mental health care. And it has done studies of telehealth for treating, for example, PTSD versus face-to-face treatment, and found that telehealth can be very effective. So there is some work out there that shows that can be very effective. And I do think one of the positives that could come out of the pandemic is that insurance carriers, it sort of moved the opportunities to telehealth that insurance carriers and providers might have been resistant to doing. I think that, but some of the challenges are just like teaching in a classroom and teaching online are not the same thing. You can't just do the same thing. It's the same thing with telehealth, that I'm hearing from providers that they have to change what they do. Instead of 15-minute session, they need to do 20-minute sessions, et cetera. And then the other piece is, will it replace the face-to-face? Sitting in the same room? Will it replace a support group where people can sort of like an AA meeting where people can sit together? I don't think it will ever completely replace that. And then the last piece is all of this, you need to acknowledge that there is a digital divide, and that while many of us have access to laptops and computers and smartphones, I think I saw the data that even in Massachusetts, about 15% of school kids don't have computers at home. So or even if they have a telephone, do they have a telephone where they could talk privately with a mental health counselor? So in order for us to move to virtual mental health, we'd actually have to, there's a lot of other disparities we'd have to address.
Just one additional question on that theme. It comes from Edric. What kind of ethical considerations should be taken into account in doing virtual psychosocial counseling?
Oh, that's a great question. So there are some basic ones. One is around informed so a couple of things around informed consent and compliance with making sure the person's informed about your patients are informed about what you're actually doing, the platforms you're using, that there's platforms that are compatible with privacy specific ones. So all of that kind of thing. And then I also think therapists have to evaluate this on a case-to-case basis in terms of their clients. Like, is their client someone who can, is safe at home to talk to a counselor, has privacy, et cetera. For example, if you're talking to someone who's in an abusive situation at home, if that's what you are working on, that's probably not something you can work on virtually. And then ongoing monitoring of your clients, risk profile in terms of suicide and those kinds of issues. But there are sort of different issues, and some of them have been addressed kind of rapidly through different organizations around the online platforms that can be used for telehealth.
Are there some strategies, this is from Moore, to cope with domestic violence in confinement?
That's a great question. And I've been talking to other people who work on this to see what people are finding works. Some of the things we're hearing are any ways that people can get any space for themselves, whether in the bathroom when they take a shower, or listening to a podcast, or sort of anything they can do to kind of time separate themselves and get a little tiny bit of space for themselves is really important. I know a lot of people are reaching out to hotlines, and I encourage people to continue to do that. I realize depending on where you live, there are challenges in terms of shelters and resources, but continue to monitor those situations, because those are changing rapidly, and places that have been closed are trying to reopen up. So those are some thoughts, but it is a really critical and important issue.
This question comes from Robert. What advice do you have for minority communities that are really being hit hardest by COVID deaths?
Yeah, that is, thanks, Robert, for that question. We had something on also on mental health disparities I think it was last week. So
you mean the thing that you host?
Yeah, the forum. Yeah, we focus on disparities and on different communities, because there are specific things people are doing. So Maggie Allegria out of Mass General is doing some specific interventions where they're working with communities and community health workers in order to reach communities that don't normally have access to sort of mental health services. Because I think we didn't talk, it's one thing to talk about telehealth, but if you've never had mental health services, you're also not going to have telehealth mental health services. So things about working with community health workers, working with local community organizations like churches. I encourage people, one thing I will say is that the sort of mental health world broadly, of which I include myself and providers, people actually want to help. So if there are people in communities or community organizations in Boston or elsewhere that want resources or speakers, I encourage people to email. I mean, they can email me, they can email people actually want to jump in. And I can say, we've done actually we did some for NAMI in North Carolina. We've done some for different communities that have reached out because, we want to. So those are available. It is one of the benefits of going through this virtual system, is that we can reach people and speak to people that we normally wouldn't be able to speak to.
And that information will be available, I'm imagining,
yes.
on the forum.
Yes, it's a website. Yeah, so our website. Yes, yes, the information is available on the website. And if people, honestly, I'm happy to have people email me and I can connect them. Maybe I'll regret saying that, but I'm saying it now. And then also in terms of, minority communities. I wish I had some great answer to that question. I don't want to, but it has really, as people have said, really put a focus on the disparities that we already faced before this happened. And those communities like Chelsea and Boston have been really hardest hit by this, and they already were under-resourced. So I'm I'm sort of an optimistic person. I'm hoping this will be a motivation to address some of those disparities longer term when, after this pandemic is over.
Yeah, I mean, in a lot of these discussions, one of the things that comes up is how a pandemic or this moment is really bringing to light and magnifying a lot of the inequities and a lot of the issues within the healthcare system and with societies that exist, and kind of raising that to the surface in a way.
Right. I mean, there were problems with our mental health system had a lot of problems before this happened. So it's just, we had these health disparities before it's happened, and it's just made them probably bigger or more glaring, maybe.
Yeah. This question's from Sue, which is, what would be the number one change that results from the pandemic that could lead to the greatest improvement in public health? Sort of leads off of.
Wow. So, okay.
Go.
So go. So the biggest change, the one biggest change, I'm not a policy person, so I'm going to speak a little more abstractly than I expect Sue wants. But I think that for all of us to understand and buy into, and I mean all of us, whether it's our leaders or those of us on the Facebook Live, our communities, to really buy in and get that health is a social good, it's not an individual good, and that our health is dependent on each other in our communities and not just on our individual behavior. Our individual behavior in terms of diet, exercise, that's important, but whether we can even exercise or even engage in good health behaviors is really dependent on the context we live in our communities and the health of our communities, so that we're really interdependent. If we could somehow shift that, and that shift could be reflected in policy, I think that would be a great good going forward.
I want to move back to a question that comes from Shantae, which gets more to kind of the actual kind of nuts and bolts day-to-day of what people are experiencing right now. And it has to do with returning to work. What are some approaches for transitioning back to work? And are there resources for learning more about like the psychological impact of that return?
Wow, that is another good question from Shantae. So this is going to be motivating for me to identify resources. I know the more at the workplaces that I'm involved in or I've heard from are very focused on more infection control and less on mental health or stress. So I think that'll be really important in terms of perhaps just raising the awareness that places should think about this. I think in terms of separating from all the measures that workplaces have to put in place for physical distancing and things in terms of return to work. I mean, my son said to me last night when he was going to sleep, he's like, wow, it's going to be a big transition when I have to go back to school, which he's out till at least the fall, if not longer. And I think recognizing that is going to be a huge transition. There may even be things, it's hard to believe right now for me, but there may be things we actually miss about this time. I know one thing I will miss is I love not having to rush out of the house in the morning and screaming at everyone, we've got to go, where's your lunchbox? I actually as much as I want to leave the house right now, I do appreciate that. So I think that it's going to be important to recognize that it's a transition and that there's also going to be a lot of challenges logistically. I don't think we know that everything's not going to start at once. So you may be in a household where you go back to work, but your kids aren't back in school. What are you going to do about that? And your whatever services, if you had a dog walker, your dog walker isn't working yet. Or people are going to have to really rebuild the logistics of their lives. And I think that's going to be stressful and a challenge. So I think recognizing it will be a transition. It won't be just like turning the economy. It's not going to be flipping a switch. It's not like we're going to go back tomorrow and we're going to be like we were before function, even if we were well functioning. It's going to take a while.
So there's a mixture of understanding that this is going to take a while. It's not a flip of a switch, and you've also been looking for some silver linings and ways to think about some of the positive aspects of this. Well, that concludes our Facebook discussion. Thanks for hanging on a little bit because there's been so many questions, Karistan. So thank you for fielding so many people's questions.
You're welcome. And thank you, Alana. And thank you everyone who joined to talk about these issues. It's really important.
Yeah. And I also want to acknowledge that you are an affiliate scientist of Harvard Chan's Center for Health and Happiness, which is meant to have existed. If also, just to bring back, as we've been having this conversation, if you, family members, need assistance with mental health, substance use, you can call SAMHSA's National Helpline. It's at 1-800-662-4357. And there's also the National Suicide Prevention Lifeline at 1-800-273-8255. And you can also learn more about CareStan's weekly online forums about mental health and COVID-19. She hosts them with her colleagues at https://me/covid19-mental-health-forum-series. We'll list them later as well. It's a mouthful. And then finally, this Q&A has been jointly presented by the Forum at the Harvard T.H. Chan School of Public Health and the World from PRX and WGBH. And you can also view this full discussion on our Facebook pages and send feedback at Forum HSPH and at PRI The World. And you can join us this Thursday, May 7th at noon Eastern Time, when we'll be talking to Dr. Barry Bloom about potential vaccines and treatments for COVID-19. So thank you again, and let's keep the conversation going.
Great. Thank you, Alana. Thanks, everyone. Stay safe.